Hello, I'm Ashley Williams, and for this week's assignment, I will be discussing National Patient Safety Goals, and this is my audience. In efforts to reducing errors within the healthcare setting, the Joint Commission has implemented the National Patient Safety Goals. These goals are guidelines that represent specific areas of concern in regards to patient safety. These guidelines consist of patient identification, communication, medication, clinical alarms, infection prevention, risk assessment, and surgery protocols. For this particular presentation, I would like to focus on hand hygiene and infection prevention. So, why is hand hygiene so important? Hand hygiene prevents the spread of germs, it protects against contamination, and it prevents hospital-acquired infections. How can hand hygiene improve patient outcomes? For one, we can reduce and prevent deaths related to hospital-acquired infections and reduce the length of stay for the patients. Okay, so let's get into a case scenario. Nurse Jackie put on proper PPE to care for John Doe in room 302, who was diagnosed with C. diff. While assessing Mr. Doe, her hip phone, which was attached to her hip, her scrub pants, rang, and she answered it. Plain Jane in room 309 needed to speak with a nurse, but it was not urgent. So Nurse Jackie, she didn't leave the room right away. She clipped her hip phone back to her waist and finished assessing Mr. Doe. Upon completion of her head-to-toe assessment, she removed her PPE. Prior to leaving the room, she used the alcohol-based hand rub on the wall, and when her hand hygiene was complete, she went to room 309 to assist Mrs. Plain Jane. So, can you guys tell me some areas of concern that Mrs. Nurse Jackie implemented with this scenario?
She answered her phone. She answered the phone that was on her hip while she still had on her PPE, her gloves, and then put it back and continued to assess that patient.
Correct. So, when she needed to answer her phone, she should have removed her gloves, answered the phone, then took off that because it's not contaminated, scrubbed up and gowned, and continued to assess Mr. Doe. There is one other area that went wrong. You guys know what it is with Nurse Jackie? Okay. Mr. John Doe, he was diagnosed with C. diff. And prior to leaving the room, she did perform hand hygiene. However, she used an alcohol-based rub instead of washing with soap and water, which alcohol-based hand rub does not kill the C. diff spores. Good.
Mm-hmm.
All right. So let's get into the evidence. It all started in the 19th century with Florence Nightingale, who promoted hand hygiene through soap and water as a form of cleanliness. Hand hygiene is a vital component in preventing exposure to infectious pathogens that could lead to healthcare acquired infections. Hand hygiene is a crucial component of safety for our patients, and it is the nurse's duty to ensure that the patients are safe. So if you see any personnel, any family members assessing the patient or doing something with a patient that is unsafe related to hand hygiene, it's okay to intervene and let them know. If you see a physician or a fellow nurse assessing a resident our patient with a stethoscope come out of that room and go into another room to try to assess with the same stethoscope, we should intervene and let them know to clean the equipment. That way we can get a control on infection, prevent infection from happening. The CDC has guidelines and recommendations related to hand washing. And some hand hygiene products are found to be more effective than others, just like in this scenario. Soap and water was more effective than the alcohol-based rub related to